Awesome. Hello, everyone. I am so delighted to be here with you today. I am so especially excited for what we are going to be covering today. I think that aging with autoimmunity is one of the most important conversations to have because the nature of autoimmunity is that it's chronic. It's something that we have forever. And so I love that we have this chance to be able to discuss this, and we are going to be jam-packed with so much wisdom. I am so thrilled to have our guest here with us today. We have Dr. Amanda Piquet. Thank you so much for your time and for joining us today.
Oh, well, thank you. Thank you for the invitation. I'm really excited to be here, and I hope at the end we'll have a lot of Q&A. And this is just going to be more of a conversation. You're not going to be bombarded with my PowerPoint slides today, but just kind of going through and answering some of these questions about aging with autoimmunity and how autoimmune disease changes over the lifetime. It's unrealistic. We change as we age from adolescence to post-menopause. So the autoimmune journey changes along with that. So just to give you a little bit of background of who I am, Amanda Piquet, as you already introduced me, but at the University of Colorado, I'm the director of the Autoimmune Neurology program here. We are chilly in Colorado. It's not snowing yet, hoping for a white Christmas, as you can see with my background.
Yeah.
In our clinic and our program, we see a lot of patients with autoimmune disease in the clinic, where we see a spectrum of different disorders. Really, my clinical and research focus are in two main diseases, stiff person syndrome and autoimmune encephalitis. Both of these disorders do greatly impact women more than men, with the exception of nuances with autoimmune encephalitis. There's particular antibodies that we see perhaps more common in the male population, such as LGI1. But for the most part, a lot of these syndromes that I'm going to be seeing and discussing about today are impacted heavily in the female population.
Yes,
Uh,
thank you. I think that is, I know at least in the NMOSD community, that is the case. It tends to be more predominant in women. And of course, there are many men in our club too. But it is interesting
and
because,
testosterone is important as a hormone as we age too. So,
right,
we're
right.
not going to single out too many people.
Right. Absolutely. What I would love for us to do today is to progress generally through, the chronological timeline of life and of how autoimmunity might affect uh, someone teens, 20s, 30s, menopause, and afterward. So why don't we begin with addressing puberty? And let me ask you this: how do autoimmune diseases, excuse me, typically manifest during puberty, and how might the um, hormonal changes during this time affect that process?
Yeah, so during puberty, obviously the hormones are changing, and autoimmune disease can become more pronounced during this time if you have a predisposing genes to autoimmunity. It's not uncommon that we see these autoimmune diseases kind of come to light in this population, and it's really estrogen, the surges of estrogen that we can see during puberty can contribute to that. So we know that estrogen, when you look at autoimmunity in general, looking what has been studied a bit more outside of autoimmune neurologic disease, but rheumatologic disease, with rheumatoid arthritis, with lupus, again, these two are more common in women, and with that surge of estrogen, we know estrogen can aggravate those conditions. So it's not surprising that we can see these diseases flare up as estrogen levels rise during that kind of puberty period.
That's really interesting. And it's interesting because it's such a unique challenge at any age. But I have to think when you're already going through so much as a teen and going through adolescence, there's so much change happening in life and internally and physically. To then have autoimmunity added to the mix can be quite a challenge. What do you see specific challenges being with teens as they are navigating normal developmental physical change, but then also encountering things with autoimmune diseases?
Yeah, so I mean that time of life is hard. You're figuring out mentally who you are, separating yourself. There's a natural as anyone grows in development, you're naturally separating away from your parents and developing who you are as a person. Also from a neurologic standpoint, our brains are continuing to grow during that time. We don't even, it's not until like age 20 to 25 our frontal lobe is fully developed. So there's a lot of just neurologic changes that are happening during that time. So you throw on an autoimmune neurologic disease on top of that, there's going to be changes with just your development, both from a psychiatric or psychological standpoint, as well as even a physical standpoint. You're still growing. Chronic pain can be very prevalent, and dealing with those things can really change um, your perspective of life in a very vulnerable period. So I think there are some additional struggles that are very unique to this population with dealing with a chronic disease, socially as well. You're missing school. You're not able to participate in extracurricular activities. You're dealing with needing to manage medications that you don't quite understand. Um, these years can be quite difficult.
Yeah. Yeah. It seems like it's one of those things that throws you right into life before you're kind of
You're
developed
ready.
ready. So what
Yeah.
advice would you give, a two-part question, to both a youth teen going through autoimmune challenges as well as a caregiver of someone in that position?
Yeah, so I think especially for caregivers, as a no child is born with a textbook in terms of like how to handle things, but so we learn as parents as kids grow, and I think you know parents and society, we have set expectations of teenagers launching into adulthood. And I think it's important to recognize, especially for caregivers, that this is a special population dealing with chronic disease. This population needs additional emotional support. They're dealing with unique challenges at a very vulnerable part of their life, and having that open communication and that acknowledgement and support, I think, is essential.
Yeah, I would agree. And one word that comes to mind, putting myself in that situation, which I was not, I wasn't diagnosed until my mid 20s, but I just feel like everything has to be given grace. Everything with the teen, everything from a caregiver, you just have to give grace to all of it because it is such a challenge and so chronic. It's not a
Yeah.
problem that you can solve. And so whether it's giving a patient grace, giving yourself as a caregiver grace, but just allowing for it to be so messy, I think can be helpful because you're right. Oftentimes we have a picture of what a childhood should look like or what a parenting relationship could look like. And this is something that can really blow all that up. And so
Yeah.
it's helpful just to kind of drop those expectations and just give grace. As we progress, then we get through puberty and hopefully we make it to adulthood with autoimmunity and still have our head on straight a little bit. And as we get into the potential for pregnancy and planned reproductive health and all that kind of thing, I think this is a really important conversation to have. Pregnancy with autoimmunity. What should someone with an autoimmune condition know when planning for pregnancy?
So for when my patients that are planning pregnancy, I think having a good relationship, especially, and I'm going to focus on autoimmune neurologic disease here, but either it's your neurologist or your rheumatologist, whoever is helping manage that autoimmune disease, work with OB-GYN specialist. And I send a lot of patients, and I think starting the conversation early is important, because I don't want to know, oops, I'm pregnant. Now what do I do? It's like, no, let's plan this together and be thoughtful about it, because a lot of the medications that we put patients on can have impacts, not only, impacts for fertility, but also impacts on baby should you get pregnant. And so having that open dialogue with your physician is important. Working with the specialists, especially with high risk pregnancy, so maternal fetal medicine, I think those things are important as well.
Yeah, just utilizing the village, all the caregivers and the specialists in your
Yep.
life. I love that. I think that's such an important thing to do with anything, but especially when pregnancy is a part of the equation, that's so important. This is another really, I'm excited to hear what you have to say about this next question. Are there autoimmune diseases that tend to worsen or improve during pregnancy?
The answer is yes and yes.
Yeah, yeah.
So,
That's
so
what I
it
figured. A lot of nuance.
it depends. Yeah, no, it depends on what the autoimmune disease is. And so I think we have really learned as a field, particularly, so use a common autoimmune neurologic disease like MS that has been just better studied because it's been around longer. We know that gets better during pregnancy. However, it's also important not to forget in the postpartum period that can actually be exacerbated and worsened, and that's when we see relapses. So it really just depends on what, and there are certain autoimmune diseases that are clearly worse during pregnancy, and it really depends on what the autoimmune disease is, because there's shifts that happen with your T cells and B cells during the pregnancy time period, because of that big increase in progesterone and estrogen that we see. So the hormones and the balance of that progesterone and estrogen drive your immune system. The immune system tends to shift from what we call, a Th1 dominant response towards a Th2 dominant response during pregnancy. And depending on what autoimmune disease we're talking with, those are regulatory T cells that kind of drive the disease process. And the reason that all these hormones do that and shift is because in reality, in what you would consider a normal state in terms of pregnancy, is you have a basically the baby growing inside of you is a foreign object. It's half your DNA, but half someone else's DNA. And so your immune system does these shifts to protect the baby, protect the fetus. And that just has implications on what autoimmune disease you're talking about.
Yeah. Well, and that just made me think, and I could be wrong here, but is that what the RhoGAM shot is for? Like if you have a different blood type, because I remember my babies had different, like I'm A
Yeah,
negative.
and that's something else. Yes, that's
Something
something
different, of
else.
course.
But that's
Yeah,
your immune system
right,
basically
right.
being attacked. So
Yes,
yes, that's to protect your immune system from attacking if you have that antibody.
sure.
And that RhoGAM, and I'm getting way outside of, my area as a
Thanks
neurologist,
for
but I think that only
for
comes up
that.
with like, protecting future babies if you develop that antibody. But
Yeah,
yeah.
yes, 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 that's right.
And special blood types and Rh positive and negative, but I'll leave that to my OB colleagues.
Sure. And the reason it came to mind is again, if we already have that baseline level of necessitated awareness regarding immune function when pregnant, it's like that's already something that needs attention that could be very dire if not addressed. But then you throw in when you've got autoimmunity, it's like as a baseline, we're dealing with, all of that blood and immunity and all that kind of thing. But then when you have autoimmune conditions, it's just so fascinating that it's like, wow, it just gets more complex and more nuanced. And I'm
Yeah,
very,
more people needing to help manage.
yeah, yeah,
Yeah.
a bigger team, a bigger team. So then if we are using that team in our village to be able to plan and have a successful pregnancy, postpartum, if there is potentially a risk or an elevated risk of some kind, what would you say are some key considerations in navigating that period?
So that needs to be a conversation with your autoimmune neurologist, your rheumatologist, whatever disease we're dealing with. If there is any change, and not all autoimmune diseases require or necessitate a change in your immune therapy during pregnancy. NMO, because I know there's a lot of NMO patients listening in. That is a disease condition. We don't alter immune therapy during pregnancy, or if we do, it's on a very unique case by case basis. But there are some autoimmune diseases, perhaps we're holding on therapy, and then it's a conversation of when to resume postpartum, making sure that does not fall through the cracks, having a conversation. Do you plan to breastfeed? What does that look like in this scenario? So I think there's just a lot of things that need to be discussed on an individual basis, just depending on the situation.
Sure, that makes sense. And it's interesting too, as a mother myself and talking about this, I just have to, if anyone listening in is going through a situation of planning pregnancy or navigating pregnancy and postpartum, it takes so much work. It takes so much coordination. And I just want to give praise to anyone that's making it work because it's already hard enough. Again, as a baseline, pregnancy can be so difficult. And so if anyone's going through that, I just want to extend a huge kudos because it's hard and there's so much work that goes into it. And if you're putting in the work, it's just a huge, way to go because we see that it is not an easy thing to do. Okay, so then if we have addressed a little bit how things in pregnancy might work with autoimmunity, and then we move more into the menopause phase of life. How does menopause typically affect autoimmune disease progression as well as symptom severity, if it has an influence on that?
So again, this is going to depend on which autoimmune disease we're talking about. There is a potential with menopause to either improve potentially or worsen autoimmune symptoms. Again, individual disease specific. So in menopause, you have this decline in estrogen. And with that decline in estrogen, if the estrogen was part of the autoimmune disease in terms of triggering or worsening of symptoms, that's why it has the potential to get better in some and decrease disease activity. So again, I hate to go back, what we have a lot of patients having it and data on, but MS, we know MS disease activity decreases as one ages. That could potentially be the same for something like rheumatoid arthritis that someone had younger, and then it kind of burns out over time and gets better as one ages in terms of the inflammatory component, but perhaps not so much the chronic changes, like for example, RA or rheumatoid arthritis, we have a lot of joint changes
Mhm.
and chronic changes from that. That's not going to go away, but the inflammatory component, same thing with MS, the inflammatory component, but we still see perhaps chronic disability from the initial um, disease process. Hormonal shifts can also cause a change for the worst in terms of estrogen going away, and that can bring out fatigue, and that can make fatigue worse, cognitive symptoms worse. So it really depends on which symptom we're talking about and what component of the disease we're talking about.
Sure. And this may be too specific of a question, but and you've kind of touched on it a little bit, but would you say there are like classes of diseases or even specific diseases that you would say could improve, classes that you would say could worsen? And it sounds like the element of inflammation changes as we go through menopause. And so diseases specific that are dealing with chronic inflammation perhaps change.
Yeah, And so NMO is kind of a funny one, right? We get this bimodal distribution. So we see it in the young, probably at the time of puberty, stirring everything up. And then
Mhm.
we get this, when I say bimodal, it's peaking in the young and then peaking in that postmenopausal or perimenopausal age,
Sure.
after the age of 50. So it's a little hard to say. Those patients didn't have NMO previously, but now we're seeing their autoimmune disease come out, and perhaps it's that withdrawal of hormones that could be kind of changing the inflammatory process behind the scenes. And so I think it's just sometimes hard to know because it really depends on the disease you're talking about and the onset of that disease.
Yeah.
Another great example is stiff person syndrome. So, when you look at our epidemiology study that we recently released, as well as prior literature, you're looking at an average age at around 50. So, you really are in that, menopause period where patients are being diagnosed. Now, did the disease start before that and you're not capturing the diagnosis for a few years? Sure, that can certainly happen. But you just wonder when you have that age group being primarily affected, is the hormonal changes have anything to do in the background? I don't know.
Yeah, yeah, that's a really interesting idea. I think to summarize, if we've looked at, if I'm understanding you correctly, with puberty, reproductive health, and then even into menopause, as with anything, it's a very individual journey and uh, a very case by case basis, depending on what disease people have and depending on symptoms that they're experiencing and phase of life. But from what I understand, it sounds like we are to utilize providers, be consulting as often as possible, and then also just listening to your body and understanding if you feel something different, then to vocalize that, to advocate for yourself, to be able to say, hey, I am going through menopause and I'm noticing some of these shifts, to bring up those things in order to find appropriate care for whatever stage you might be in.
Yeah, and especially, like I said, the symptoms can get worse during menopause. That doesn't mean the disease activity is always getting worse, but those chronic symptoms that are so difficult, like
Mm.
fatigue, some of the brain fog, cognitive symptoms, that can really worsen. And so I think when you're going, you're at that time, it's how much is autoimmune disease, how much are some of these other things? What can we do? And I know we're not going to get into it here because it's a whole can of worms, but hormonal replacement therapy, um, can that be helpful? And consulting with specialists that can help answer those questions, I think is important.
Yeah, absolutely. Let's continue with this thread of brain fog and cognitive function that can be affected by autoimmunity. Does having any type of autoimmune disease, does it increase the risk of cognitive decline? Does it increase the risk of memory issues or even just, have an increased prevalence of brain fog? What do you see in that area?
So we need more research.
Yeah,
Is the first thing.
always.
There are things that I can just give kind of broad strokes to, but we need to study individual diseases and study really what is that cognitive issue that we're seeing to understand it in each disease state. But I would say broad strokes, I definitely see a lot of patients that have that concern and issues with brain fog. And
Mhm.
what that is, I kind of describe it as a cognitive fatigue. And as we age, and I think what makes it even harder is if you have an autoimmune neurologic disease on top of aging, you kind of lose what we call a cognitive reserve. So
Mhm.
you can imagine, this is what I tell patients after the age of 35, everybody's brain starts shrinking. Brain and spinal cord just starts shrinking. That's a natural aging process. And there are things that you can do in terms of just healthy living, good habits to really build up your cognitive reserve. But when you give hits to the brain, they all take a little piece, and it becomes just harder and harder to concentrate, to really bring your attention onto things and deal with things like multitasking. And that's really where that cognitive fatigue and that brain fog really shine when you're dealing with all of those issues. Um, so healthy things that you can do to avoid your brain shrinking faster than perhaps, an age match control is avoiding smoking. If you have diabetes, making sure that's under control, making sure your blood pressure is under control, eating a healthy diet. And then unfortunately, in an autoimmune neurologic disease, um, can control to a certain extent with immune therapies perhaps, but that's just an extra hit. So whatever you can do to help those other things to build up that cognitive reserve will
Mhm.
benefit you. is
And
that
could
is that clear? That was a little bit of rambling, but
Oh, that was great. And I would love to build upon it by elaborating even more, because I know this is a common question that I get myself as a patient, and then just generally as people are asking about how to manage it. But can you build upon some of those lifestyle factors? So there's the medical factors of managing if we have congruent diseases and other pre-existing conditions, staying on top of those. But in terms of just general lifestyle, eating a healthy diet or movement where possible. Granted, when you have autoimmune disease, that can really limit movement, which is such a difficult challenge. But could
yeah.
you build upon what some of those lifestyle factors are that could help support cognition and
Yeah.
avoid?
So I'm going to start with the easy things. Get rid of the bad habits. So the bad habits are smoking, heavy drinking. Those things are going to impact the brain. Like you said, moving can be difficult depending on what the neurologic disability is, but any type of cardiovascular exercise, whether, if you're unable to walk, even just upper extremity, something that you can do aerobic wise to get that resting heart rate up, is going to help blood flow to the brain. And that's just good for brain health.
Yeah, yeah.
And then when talking about diet, that is also a very complex conversation. But there are definitely foods out there that are clearly just bad. Simple sugars. Um, those are going to contribute to fatigue and brain fog and cognitive fatigue.
Yeah. As they would with any person, right? But then it's like extra
Yeah.
with
Yeah,
autoimmune.
I eat a large, donut with sprinkles and icing. I'm gonna want to take a nap after that.
Yeah, it's true. It's true. I want to address a couple other more specific elements of what can happen with autoimmune disease. I first want to ask about bone density, risk for osteoporosis if autoimmunity plays into that. I know women lose muscle as they age naturally if they are not proactively resistance training to prevent it. And so we're already prone to that again. Us as women, we're prone to a lot of things, and then autoimmunity just makes it that much more
Worse.
fun. And so when we have the presence of autoimmune diseases, how does that, if at all, affect bone health over time?
That's a really great question. And I have to say the rheumatologists probably do it better than the neurologists because we get so focused on, neck and above thinking about the brain. But bone density is something to really think about, particularly as you age. As you said, with the loss of estrogen, postmenopausal, you're already kind of taking that hit on the bones. And then you add on a chronic autoimmune disease that perhaps requires courses of steroids throughout a lifetime, that's just going to add to that deterioration of the bone density and affect your bone health. So staying up with regular checkups, making sure you're doing DEXA scans, staying on top of that, that's probably the most important thing. And then implementing medications if needed.
Mhm.
Obviously, things that are good for just building that bone health, calcium, vitamin D. Vitamin D is good regardless in autoimmune disease. So I don't want to forget those simple things.
Yes. And sometimes it does come down to those, right? It's such a complex puzzle, but we forget sometimes those most simple elements that can be really helpful just in how we feel quality wise and how we age. Um, let's talk a little bit about bladder and bowel health, because I feel like bone health is something that can be a general question for people. And then at least in the NMO community, that's one perk of having the disease is bladder and bowel health, something we get to think about a lot. I would love to know what effect autoimmunity can have on those functions.
That's another tough one, and that's where it is so important to have your multidisciplinary team. And so, one of the things that we work on here is, yeah, I have my go-to GI doc on call. I have my go-to urologist, and just making sure that when I see a patient, I'm asking those questions, and even if I don't, have the answer, because sometimes you got to think about other things with autoimmune disease and bladder. Is it neurogenic bladder? Is this a UTI? Is this interstitial cystitis, which unfortunately we just see coexist with other autoimmune diseases? And making sure you reach out again to those specialists, building a team, building your village, so we can explore kind of the right etiology and get on the right treatment plan.
Yeah. Yeah. Again, it just comes back to that village. Thank goodness we have them, right?
Yeah.
In terms of sexual health, how does autoimmunity play into that? And what would be some proactive things you would recommend to support patients in the realm of sexual health?
Yeah, so I mean, autoimmune disease certainly affects sexual health. It can cause, again, depending on what the autoimmune disease is. If you're talking about um, spinal cord involvement, you can have pain, you can have lack of sensation down there. I have patients with step person syndrome that have a lot of pelvic floor dysfunction, so that can cause pain, painful intercourse, and sexual dysfunction. Hormonal imbalances can also lead to vaginal dryness, which also leads to sexual dysfunction. So I think, you know, it kind of depends on what the issue is. If it's a pelvic floor dysfunction, doing some PT, pelvic floor physical therapy can certainly be helpful. Pain, making sure you're working on adequate pain control. And then, there are some things that are just really difficult. Like I said, if you have a lack of sensation down there, that can cause um, emotional distress, and sometimes therapy is kind of helpful to work through that.
That's something that came to mind. And as you were talking, it was a good reminder to me. And I want to reiterate this to our listeners today. But I think, especially as women, sometimes we can experience symptoms like you described and think something's wrong with me. And instead of jumping to that conclusion, I think it's important that we recognize that sexual health can be affected by autoimmunity, just as bones and bladders and bowel, all of it can be affected. And so if there is an issue, before you assume that something is just inherently wrong with you, remember that there's a lot of things at play, and there's likely something you can do to support yourself and get the help that you need. I think therapy, that's a great point that can be so helpful, because there is such an emotional toll when you're dealing with so much. But in the realm of sexual health, it can be very emotional and challenging when it comes to autoimmunity. Before we open up to questions, I just want to ask this broad question of, if you could give one piece of advice to someone in each stage that we've kind of addressed today, what would it be?
Yeah, so I'll start with how we started with the adolescents. So for the teenagers, the adolescents, the young adults dealing with autoimmune disease, like I said, this happens in a vulnerable period of your life. I think it is very, very helpful to take control of your health, advocate for yourself, and seek support when you need it. Um, we'll move into adulthood. I think we kind of get into the routine and you're in your status quo, uh, but make sure you're taking care of yourself. You're prioritizing self-care. You're managing stress. You're making sure you follow up with your regular checkups. And then when we get to the other end of the spectrum, as we age, post menopause, we talked about staying on top of those health things like bone density, heart health, stay active as much as you can. And it's okay to ask for help. And really, it's okay to ask for help for any age.
Absolutely. I completely agree. And I would add showing up to things like this to know that you're not alone. We're all going through it. We're in it together. We're in these trenches together, and there are resources and things that are there to help. That's why I just am so excited to be a part of this and to talk to you. It's like, man, what a great world we live in, that it's like we can have a horrible health condition, but it's like we've got resources. We've got things people didn't have. I'm going to jump into the chat. I've already seen some questions that I am going to throw at you, Dr. PK. And anyone here, if you have more questions, please put those in the chat, and we can discuss them for you. Let's see.
Good. I was not managing the chat well, so
Oh, that's what I'm here for. I wouldn't have a job if you were having to do that. Laura asks, do we know if pregnancy has a good or bad long-term effect on a woman's life overall, like prognosis for someone with MS who gave birth to kids versus someone who didn't? That's an interesting question.
that is a really interesting question. I don't know if there's ever been an observational study looking at that in relation to MS or another autoimmune neurologic disease. I can tell you it's known to be beneficial, particularly if you're breastfeeding after pregnancy for things like breast cancer. So I don't view it as a bad thing, but I
Yeah,
don't have the data.
that's true. No, I love that question. That would be an interesting one to explore. Joanne asks, what information can you share about a patient that develops NMO late in life, 20 years past menopause?
So yes, that happens, and I've seen it, and that's part of that bimodal distribution. And I mean, while I think hormones are important, we also know men get NMO, and they don't have the same estrogen women have. So not everything hinges on the hormones. So I think these things can happen and be unrelated to our cycles. So I don't know. I don't know if I can blame much on the hormones if we're talking about 20 years past menopause. Um, I don't know if there's more information or
In the
people
question,
allowed to chime in,
Joanne,
or
if
they're
you
not allowed to talk.
if you want to add to your question for us to help us elaborate, we would welcome that. Um, I found that well, of course, there are so many challenges with autoimmunity, but the the level of unknown can be really difficult when it comes to that emotional component. You're already dealing with
Yeah.
physical symptoms and things, and then you've got that emotional component where you wonder, you're like, why is this happening to me 20 years after menopause? Like you just wonder, and that can be one of those things that's
Yeah.
difficult. And
No, and not having all the answers is scary. It's scary, and we live in a world of a lot of unknowns with autoimmune disease. I mean, the nice thing is we have a lot of questions and we're able to do a lot of research and look into it, but there are unknowns and that can be scary.
yeah, it can be such a challenge. Let's see. So Joanne responded and said, I'm 70 years old and was just diagnosed without prior symptoms.
Yeah. Yeah. And NMO, whenever that aquaporin 4 antibody or, we're learning other things, but decides to pop up and wreak havoc, it can happen at 70.
Yep. One of the great parts of being human. Okay, Laura asks another question. Okay, I'm hitting with more questions. Bring them all on, Laura. We love them. Are there any links that you know of between endometriosis and neurological autoimmune conditions? Again, I love that question also.
I love that question too, and I don't think I have an answer to that one. I'm not aware of a link.
Yeah.
Not aware of a link. Now, endometriosis, I think, can make certain conditions when you have that in addition to autoimmune disease make it worse because of just the pain we can see with endometriosis, particularly pelvic pain.
Sure, sure.
And they can
Yeah,
also wreak havoc with GI symptoms, which, obviously those can be flared up with autoimmune disease as well.
yeah. That actually transitions well into, it looks like Tensi. I'm sorry if I'm pronouncing your name wrong. Um, Said, I've had Hashimoto's since I was 23 years old, now 46, diagnosed with NMO in 2023. Is having autoimmune diseases, does it make you more susceptible to getting another one?
Great question. The answer is yes. Autoimmune disease loves their friends. Once you have one autoimmune disease that is a sign of a dysfunctional immune system, you are prone to developing subsequent autoimmune diseases. I would have to say Hashimoto's or autoimmune thyroid disease is probably, the most common autoimmune disease that we see. So it's very common to hear that history. By the time someone comes in with an autoimmune neurologic disease such as NMO, oh, I have a history of autoimmune thyroid disease.
So that's interesting. That's the most common that you see is Hashimoto's and thyroid disease.
Autoimmune thyroid disease, I believe, unless there's new literature that I didn't read in the last year or so, but that is the most common worldwide autoimmune disease.
Wow. And you may not know the answer to this, but is that within recent decades that there's been an influx of it, or has it always been that way, or is it just because we've only recently learned what it is and how
I
to?
don't know what the change. I don't know what the change of prevalence has been throughout the years, but it just when you look at just prevalence, incidence of any autoimmune disease, that one's the most common.
So
It's not
interesting.
one we think about, right? Some people don't even think about it as an autoimmune disease. It's like, oh, I'm on thyroid medicine.
Right. And that's one of the difficult things too, is the range, the spectrum of autoimmunity is so wide. You can have life-threatening and you can have more benign, and it just
Yeah.
runs the gamut.
I mean, another one we see is type 1 diabetes. That's an autoimmune disease. And
People
I
forget.
think we
Yep.
kind of forget that that's an autoimmune disease, but that's driven by autoantibodies against the
Yeah.
pancreas.
Yeah, yeah, that's such a good point. Sonia asks, are there any markers our children should be tested for if I have three different autoimmune diseases?
I don't know where that question is, but I think that's a great question. That's not something that we have mainstream in terms of practice, in terms of screening for kids and family members. I do have to say I advocate for my patients to let their family, especially their kids, know if they have an autoimmune disease, because if their kids show up with anything funny, I think it's important in that medical history that the physician is aware of what that family history is, because that can give them clues.
Yeah, yeah, yeah. That's such a good point. Having those clues can be so important. Laura asks, what exercises do you recommend to get your heart rate up for people who have autoimmune neurological conditions and whose mobility may be affected?
Yeah, so like I said, it depends. If you're talking about lower extremity mobility issues, there's a lot of arm exercises you can do, and we actually have a great. And I'm not a physical therapist, but we have a great program through our nonprofit organization here in Colorado, Rocky Mountain MS Center, and they have a virtual PT for patients who really just like have a difficult time, getting out into the community, getting to either outpatient PT or the gym, and they have online exercise programs, and they will work on those things.
Yeah, that's such a good point. And I think that is an important thought for people, in your situation, Laura, to recognize is that if you struggle with exercise or if mobility is limited, there are very likely people that can help you who know exactly how to work with you in a way that will suit your needs. So that's a really good point. Fred says, as a guy with NMOSD, I was diagnosed at age 65, and not being in the medical area, it's hard for me to uh, life of distinguish life effects and normal aging issues.
Aging issues. Yeah,
Yeah.
and that's what I said. That's tough, particularly at the age of 65. You come in with symptoms, it's like, oh, I'm being a little forgetful. Is that old age or is it
Being
my
a human
autoimmune
or
disease?
yeah, yeah,
And so I think you just bring those things to your doctor and talk about it. And sometimes I don't know, especially when it comes to cognitive. I'm like, I don't know, but let's do neuropsych testing. Let's dig into it a little bit more and clarify that.
yeah. And this is part of that, I think, level of self-advocacy. And I always go in with the mindset of it can't hurt, might help, right? If I've got something where I'm like, I'm not really sure if this is an issue or it isn't, it can't hurt just to look into it because I feel like with autoimmunity, like you said, clues are everything. And so even if you have something and you're able to explore something for more information, at all times it could potentially help the picture of your disease and your, what could help you broaden and get more clear.
Yeah, and I have patients come in with kind of list of things like, you know, to address, and they're like, I don't know what's important. I'm like, that's okay, I can be your filter.
Yeah, 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 right. That's why we need that village. And Kita makes a point here saying we in the autoimmune community often talk of needing a village or a team of health practitioners and helpers. I know we're all different, but what practitioners should we have in our toolbox? I have SPS, so I am sure my team would be different than other diseases, but a general list would be helpful. That's a good question.
Yeah, that's a great question. So with SPS, your primary point of contact is probably going to be your neurologist and likely an autoimmune neurologist or neuroimmunologist, or in some cases, neuromuscular specialist. With a rheumatologic disease like rheumatoid arthritis, lupus, your point of contact, kind of that person overseeing everything is your rheumatologist. And then I think it's a little bit of a depends on the disease that you have and the symptoms that you have, what we need to do with building out that team around you. I think, regardless of whatever the disease is, things like therapies should not be forgotten. So, whether that's physical therapy, occupational therapy, mental health therapy, those things are probably important across the board. But some patients are going to have GI symptoms, in which case, you're going to pull in your gastroenterologist. Some patients are going to have urinary symptoms, so you're going to pull in your urologist. There are some diseases, which we didn't talk about today, but neurosarcoid is a disease that we see in our clinic, and sarcoidosis affects every organ. So you're sometimes signing up to have a neurologist, a rheumatologist, a dermatologist, a cardiologist, and a pulmonologist. And so I think your ringleader and your kind of point of contact is going to be either neurologist or rheumatologist, depending on what kind of autoimmune disease we're talking about, and then it builds out in rings from there.
Yeah. And just speaking from my own experience, I have my neurologist who's just one of my favorite people in the world. And then I also have just a primary care often that I can just send a quick message and be like, hey, and sometimes it's autoimmune related and sometimes it's not. But I've found that kind of those two together have been good to just get referrals like, hey, I'm having this issue with my ear. Can you send me to an ENT? Like, is it NMO related? I don't know. But to have those both to be able to kind of work in tandem to get all the referrals that you need in order to build that team. I
And
found
and thank you for keeping me honest. Yes, I forgot the generalist. They are key.
gotta have a generalist too. Gotta have those. Yes, and I found having a good like patient interface that I can message quickly and you kind of learn those things. You learn the ropes as you get more into the weeds with autoimmunity where it's like, oh, I want to be able to send a message and get a reply and so you kind of have to experiment. You have to have space to allow to find the right people because sometimes it's not a right fit and that's okay. Autoimmunity is just a patience game.
Yeah, and depending on where you are in your disease course too, I think matters. When the closer you are to the diagnosis, and just starting treatment, our appointments are closer together. So you're gonna see our clinic perhaps a little more frequently in the beginning, and then when we feel like you're on a stable pathway, space out those appointments a bit. And so I think those frequent touch points are important, especially early in the disease when you're just trying to figure it out.
And obviously it helps with the physical health dealing with the disease, but I think there's also a mental and emotional element just to know it's like I've got people on my side that are looking out for me, that are going to respond, that are going to take care of me. That's something that if you don't feel like you're getting as a patient is important to advocate for yourself and to, switch providers if necessary, where possible. I know that can be such a difficult thing, but advocate for yourself to find a team that you feel supported by.
Yeah.
Meta asks, I'm a student nurse with NMO, and sometimes it can be very hard to do 12-hour shift placement as my fatigue symptoms and side effects of the medication that I'm taking can make the shift very exhausting. Is there anything you would recommend that I should do to ensure that I'm able to do a shift without having any issues while on placement? A great question.
Oh, that's so tough. I'm sorry to hear that. That's tough. 12 hours is tough, and that job is tough. And so, I think talking with your neurologist would be important because I just wonder if there's something that can happen in terms of accommodations. When we talk about the village, we'll come back to that. We have social work and a whole nursing team that can kind of help navigate some of these disability needs if you need to take either time off or have a reduced workload.
Yeah, absolutely. I've got another question from Michael Devlin, who said, "What are the most common overlapping symptoms across the various neuroimmune and related autoimmune conditions: NMO, MOG, AE, lupus, Sjogren's, Hashimoto's, etc."
Sorry, can you repeat the first sentence again? Because I was scrolling down and I did not see that one.
Yes, it's a dance, isn't it? What are the most common? This one is in the Q&A, Dr. Piquet.
Oh, that's why I was like, I don't see that one.
I know. Yes. What are the most common overlapping symptoms across the various neuroimmune and related
Yeah.
autoimmune conditions?
And that was NMO, MUG,
MOG, AE, lupus, Sjogren's,
lupus.
Hashimoto's,
Oh my God, that's all of them.
all of them, everyone. We
All of
need
them.
answers for all of them.
I think the hardest one for us to address and treat, I think fatigue. Fatigue is just ingrained and part of every autoimmune disease, and it is the bane of our existence because it's so stinking hard to address.
Yeah. That was not that I'm an expert, but that was one thing that came to mind is I'm like, sometimes it's just feeling worn out and tired.
Yeah. Yeah, exactly.
Laura says, thank you so much, Dr. PK, for your time. This was incredibly informative. Thank you, Taylor, for organizing. I didn't organize it. This is Sumaira and Amgen, but thank you for giving me some credit. No, just kidding.
Thank you,
Also,
Samar and
you.
Amgen.
Yes, yes, yes. Thank you all for organizing this. I think this is such an important topic. Um, let's see. We've got Susan who said, I have NMO and I'm on the preventative and spring. Is it inevitable that I will relapse at some point, or is it possible to never have one?
Oh, Susan, that's tough. That's tough because I don't know all your background, but I mean, all of the new FDA approved therapies for NMO are very efficacious, but none of them are 100%. So, keep working with your neurologist.
Yes, keep working, keep advocating for yourself, and everyone is on your side to make this work. Let's see. Okay, and then Sumara, I think we answered this question. This was Fred's question
Oh,
where we
you
said,
did. Okay, I'm sorry.
I believe we did. Fred, if you have any follow-up questions to that, you are more than welcome to pop that in there. Otherwise,
I have
if
to say though, sorry, I'm coming on looking like a gremlin here. Hi, everyone. Good
you're for
evening.
the gremlin.
This has been a really, really insightful conversation. First of all, obsessed with the both of you. It's like watching Oprah or something. But
Oh,
Fred's question really resonated with something I have felt if I can ask a question as a patient, which I rarely ever get the chance to do. But, he said that he can't sometimes differentiate what's due to aging and what's due to autoimmune disease. And I have been feeling that since I was 25. Like sometimes I'll tell my friends, like, even though I look okay, I'm like, whatever, I look normal, I'm whatever normal means, but I'll tell my friends sometimes that like my body feels like it's 75. I'll just like bend over and everything hurts, or like just getting up or like getting out of bed, everything hurts. And like, I'm like, is that NMO or is that I'm just in my mid 30s now? What is it?
let's just blame. We'll
We're
just
we're
blame
gonna we'll blame
ourselves.
NMO.
Okay,
Well,
we'll blame
that's
that.
MMO. We'll say that's MMO. It's not because I'm getting old. It's not because
Yeah,
another reason is because of my autoimmune disease.
but it's so wild because I'm like, my friends who obviously don't have these diseases, like they're like, we have no idea what you're talking about. And so it's like it makes you feel even more isolated too, I think, because you're trying so hard to like keep up with the Joneses, but actually inside everything hurts and like you're tired and like because you look so normal, you even I'm just projecting here now, but like I don't even complain about it or vocalize it because I feel like no one will believe me.
Yeah, and that brings up a really good point, and something we see very commonly with neurologic disease. It, on the outside, people don't recognize what you're going through, and I think we have a tendency as individuals to compare someone else's outsides to our insides, and that can be tough just from a mental health standpoint when you do that. So
Yeah.
we got to let go of that exercise and know that with autoimmune disease and neurologic disease, we're dealing sometimes with an invisible struggle.
That's what I was just going to mention is that idea of it being an invisible illness. And it's part of the burden that we bear that can be so challenging.
I think it's so helpful for patients to hear exactly what you just said from someone like you, because even myself, I am like, okay, because it's not visible to the outside world, maybe it's just in my head, and I should just keep working at the pace that I'm expected to at my age or whatever, whatever. And then you run yourself to the ground. I mean, it's a really toxic cycle. But now that I've like heard it from you, I'm like, okay, maybe it's not in my head, and I should show myself a little more grace.
Yeah. Well, and Fred just said here, it makes me feel like I'm crying wolf all the time. And that's where it just comes back to, and this is more of like a mental health perspective, but that relationship that you have with yourself to be able to say, I'm feeling something. How can I take care of myself instead of feeling like something's wrong with me? I'm different than everybody else. I should be functioning differently or functioning better. And that can be, can just aggravate things and make it even worse. And it's so challenging.
And just something that like I'm learning as I'm like getting older and trying to navigate this crazy world in life is that like we have to get comfortable with accepting that we will, whether you have an autoimmune disease or not, we will never be the same person we were yesterday. Just like physically, biologically, it's not possible. We're a day older every day. So instead of trying to become who I was or constantly compare myself to like who I was before I got NMO or who I was in my 20s. Like now I'm trying to teach myself, which is very hard, I think, whether you have a disease or not, that like it's okay to get older. It's actually a privilege to get older. And we're so lucky that we have the chance to age and even have the discussion about aging.
Yeah, it is such a gift. And sometimes it can be hard to see it that way, but I couldn't agree more that it is such a privilege that as much as life is messy and bodies are messy, it is a privilege to be able to experience them and to experience the world and to age with it. And yeah, it's a perspective piece that is important to have and also giving yourself grace and recognizing. And it's also really hard.
Yeah. Well, that was such a lovely webinar, ladies. Thank you so much. Oh, there's one more comment. Taylor, do you want to read hers?
Kita says, looking back in time as a 62-year-old, I was probably starting an autoimmune process. I kept pushing and trying to keep up or fight myself physically and psychologically. I feel like this kind of stress manifested the diseases.
Mm-hmm.
Yeah, that's an interesting thought. Any thoughts on that, Dr. Piquet?
We know stress makes autoimmune disease worse. We know.
Yeah,
Yeah.
yeah, direct correlation. Joanne says, I think it's really important to become friends with someone close in age that also has NMO. You can get support and talk about how you're feeling. I could not agree more with this. And Sumaira, our experiences were so similar. Like there just is something that bolsters your soul when you have someone that you just are connected on, you might not be connected in any other way, but just to have that connection of we have a disease that we share, and knowing that you're not alone in that can be so helpful to be like, I'm not as isolated as it might feel like in my day-to-day life. I do have people that understand how difficult this can be.
Well, you were that person for me.
We're a good team.
Yeah, we are. Thank you both so much for this great program. I'm so glad we recorded it so that other people can watch this if they missed it tonight. But Dr. Piquet, you are an icon in our world. We look up to you so much.
Give me too much credit.
No, I mean it. Like,
Deserve all the credit.
as a woman, as a young person, like you've just accomplished so much. So like, congratulations to you and all of what you do. And I'm sending you so much good juju so you could just keep going and going and going. And Taylor, you were an incredible moderator. I knew you would be, so that's why you're doing this and not me. But thank you for also, sharing your lived experiences, which I know is not easy to do on such a public platform, and facilitating such an important conversation that people will reference for years to come. Thank you both.
Thank you so much to everyone. I'm so glad I got to be a part of this. Such a gift.
Good night.
Thank you. Happy holidays, everyone.
Happy holidays.